Hello everyone and welcome back to the Diary of an Endodontist. External cervical resorptions can be very tricky, especially when they are interdental ones. It's difficult to restore, it's difficult to clean, it's difficult to even judge whether you can save that tooth or not. So if you have that doubt, stay with me, I'm going to show you. So this patient was referred to me, and as you can see, is a quite large external cervical resorption and is interdental on that upper right one. In this case, the patient didn't have any sensation to endofrost, so this tooth was completely necrotic and needed a root canal treatment. The cervical resorption was already inside of the canal, and you can see a little bit of an extra one. In this picture, you can see a little bit better, an extra one over there. So what to do in those cases? The first thing you want to do is to access the tooth. But when you access, the problem is it starts to bleed quite a lot and you cannot see what's going on. So instead of panicking, just go in there and clean. You can have like a slow spheric burr, just to a carbide one, just to clean that cavity without perforating the root, because that area is so thin, and the last thing you want to do is to destroy that, because that will work as a scaffolding for you. You need that to build the wall. So I would say just be gentle, remove the granulation tissue. As soon as you remove that granulation tissue, the bleeding will stop. Or if it doesn't stop completely, it will just be so mild that with your magnification, you will be able to go in there and just block that. So the way you do, you can use a hot tip and just cauterize that area to stop bleeding so you can work. When you access and see how big that external cervical resorption is on the outside, like how big that hole is, then you will judge how you are going to restore that tooth and if you are going to restore that tooth. So in my case, we were quite lucky. There was enough tooth structure, was just few points that I could see that the bleeding. So I cauterized those points and I managed to do the root canal treatment. So if I can use sodium hypochlorite, just use a first drop and see if the patient is going to taste it. Make sure you adapt a matrix, and you can isolate that matrix. If your rubber dam is compromised, you can put like some putty underneath. So you can do as much as you want. You will see on the other slide, I put the putty as soon as I started using the sodium hypochlorite. Clean that completely, wash, do your root canal treatment, carry on with that. And as soon as you have your root canal finished, it won't be a problem for you to measure because everything can be dried inside. So then you can, as soon as you finish the root canal treatment, you are going to restore that tooth. And my advice in this case is I want to use the putty, the bioceramic putty, at the same time I'm restoring. I don't want to leave like a visit for that to set, but I cannot wash that. So before you put your putty, etch the external part of the tooth. It depends on which bone system you are using. I use the 3-in-1. So I will etch, I will do like a selective etch. So select the enamel and etch the enamel. And then I'm going to do the application of my bioceramic putty. So roll that as if you have like a snake, and you can get just a tiny piece and you just plug in where the perforation is and just try to rebuild that wall. Not as much because you want the composite to bond, but in that thin layer, you may not have the matrix good enough for the composite to bond. So sometimes it's better for you to have the bioceramic putty in there rather than the composite. So you need to judge what you have as a surface. And if you are happy with that, then you can start your bond. And the composite I'm using is the extra base. I love that because it has a long tip and I can put the long tip and I can see where I'm going. I can use the DG16 just to vibrate so you don't have any bubbles in there, and you can build that tooth with a composite. Both composites I use, that's the FieldTech, both are bulk fill, and I love that because I don't need to worry that much in doing increments. I can do like a good 4 millimeters. I don't do 4 millimeters, I do less, but it's enough to use less increments in it. And then that's your end result. So remember that you had a tiny resorption. So the question was, I couldn't access that from the inside. I had to go on the outside. And the question was, do I need to really remove the enamel to do that, or I'll leave that buried because I won't have any blood supply to feed that? That means that that will stay stable, won't grow. But what about if it was bleeding so much that my concern was it could have a little bit of blood in it and that tooth will discolor. So I decided then to access and to do the composite on the palatal aspect of that tooth. I hope you have enjoyed that. I hope you now know how to manage those cases. And if you have any comments, any questions, just drop in the comments below. And if you like that case, please share it with your friends. That will help us grow the channel. Thank you very much.